away. Let me take this opportunity to introduce our next guest speaker. He's one of those guys that epitomizes a multidisciplinary and integrated approach to health and wellness. He is the director of Century Wellness in Calgary. He's also the 2013 founder of the Institute of Century Wellness Massage School, which is a great licensed registered massage program. He runs a martial arts studio, and just FYI, he also has a black belt in martial arts. His clinic operates under a very cool motto: mind over matter, as well as matter affects the mind. So with this in mind, we'll be reminded today how our mind can influence the body, and conversely, how a body that is healthy or unhealthy can also affect our state of mind, all the way from elation and passion, all the way down to depression and uncertainty. So all right now, let's open our heads and our hearts to Dr. Michael Yoon.
Thank you very much for such a warm introduction. And yes, I am a martial artist, and I'm going to be talking a little bit about my background and how I became who I am as a chiropractor, and how we have taken the advantage of integrating with different healthcare providers to work together as well. So first of all, I was born in South Korea, and at age 4 years old, I started training martial art called Hapkido. Hapkido is a Korean self-defense art. And what's interesting is my teacher, my master, is my father. He's 85 years old, and he's still super strong and very, very healthy. And through his training, I love training, I love martial art, but I've actually trained for the reason of being the best I can be as far as training goes. But my father's background is very, very interesting in that he was part of the Korean national defense team. He was actually judged for presidential bodyguards. He's the one who says, yeah, you're good enough to be president bodyguard, and you're not. He also trained 3,000 paratroopers. He was awarded. He has done so much to cast a big shadow upon me and my younger brother, who's also a chiropractor. Okay? Growing up in a family whose father is a Grand Master, I've never been to military, but it felt like military. You get up on time, you respect, you clean, and you have good manner. And if you don't do things right, I just say, he says, get down on your push-ups. I say, how many, sir? 100. So that's the way of that I've been raised and brought up. Now, through his emphasis in training, I've done a lot of martial art demonstration. I was actually chosen as Athlete of the Week when I was a teenager, Channel 2 and 7. Do you remember those days? That was before YouTube and internet sensation. So, we've done a lot of training, we've done a lot of demonstration. We did a halftime show for Calgary Stampede. We've done demo for Chinook, South Center, all the schools all over Calgary. And the reason why we did that is my father wanted to emphasize martial art could be good for self-defense and as well as self-offense, but also as well. So through this training, my father opened up 4 martial art academy, and the whole emphasis of teaching was to teach young generation the things that I've been taught up as a martial artist, which is respect, manner, and taking care of your well-being. This culture of training was also adopted to my own family. I have 3 sons. They're currently 14, 16, and 21. And they've been starting training since they were 3, 4 years old. They still train 3-4 times a week. They teach class, and they basically follow the same kind of philosophy of health and wellness. And my wife is also a black belt too, so if I don't behave, she kicks my butt. Now, my father not only was a martial artist, but he was also a doctor in Korean traditional healing. He's an acupuncturist and also joint setter, joint healer, pressure point. So he's been training as a practitioner in Korea And in Korea, they don't call it chiropractic. They call it joint manipulation and joint setting. And now, I don't know if you ever see any kung fu movies. Do anyone watch kung fu movies? Sometimes the kung fu sifu martial artist is also a healer, right? Now there is definitely a purpose to that, in that through training, even though we're training well, we could potentially get injured. And that injury allows that practitioner, who's a martial artist, could actually emphasize some kind of a healing art. So when I was a kid, my job was to get up early morning at 6:30, go to his bedroom, half asleep, and I worked on his body for 20-30 minutes doing massage. Now I thought I was just being a good kid, being a good son, but what he was teaching me is anyone could break the bone, anyone could hurt the person, but you also need to learn how to heal. So I did that from that age all the way to 18, and that's how I've been brought up. Go to school, after school, go training, wake up, give massage to my dad. So Hapkido basically stands for, Hap means collect, Ki means power, Do is way. It's a way of collecting power. Now I find that martial art, whether it's Hapkido, Kung Fu, whatever it may be, has a fighting and self-defense art, but also it has a component of mind and body healing. So if you see some of these old photos of my dad twisting some students around, you'll see on his wrist locks, twisting, these are joint locks. And then in healing art, we can actually do stretching on these wrists to allow the body to be much more limber and healthy as well. So I find that these things are the same coin, but it's just the two different sides of the coin. So through evolution of fighting art, right now, especially after a pandemic, martial art training was tough. However, we still continue to teach and train, not for the purpose of going out there and then defending, but also using the same philosophy in stretching, mobility, and range of motion to improve people's well-being. We do that right now for young kids, but also middle-aged and older people to keep the body nice and limber. So our philosophy is kind of like what has been said before, is health in mind and body, healthy nutrition, forming good habits, having good manners and respect is very, very important. And also healthy competition, setting goals, and most importantly, being very, very thankful is essential in our family household. Now, previously, Dr. Lou Hugo said that most of the mental problem comes about when you're younger, right? And I don't know if my parents really knew that, but they understood the importance of well-being in our family. And it started with self-care in the mind and body, which is very important. Now you may be thinking, well, what does that got to do with what you're going to be talking? Well, that has developed into a scene of what I'm going to do in my career. I wanted to be a doctor, but I want to use my hand. I want to be able to treat the person with my hand so their body can actually heal naturally. So I became a chiropractor. I graduated back in 1998, and I'm coming up 24 years into practice. And Life West was great. They had the technique, the skill, and the philosophy, and I was excited to tackle the world. I came back to Calgary in 2002 after practicing chiropractic in Bay Area for about 4 years. And initially, I was excited. I wanted to treat everyone and help everyone. And my main emphasis of treatment was chiropractic spinal adjustment. So I believe in that. I believe in clearing the subluxation, clearing this joint fixation, allowing the body to move very, very well. And it's to this day, I still believe in that. The only thing is I had some limitation in getting people better. I actually did quite well with kids and young people who had some good mobility, but I had some challenges with people who have a lot of restriction, a lot of scar tissue, and a lot of modern day problem. So some of the problems I actually had problem was soft tissue injury, people who have chronic trigger point, people who have adhesion, some tears like rotator cuff, osteoarthritis, and osteoporosis in elderly clients. So when I first started practicing, I'm going, I gotta really learn some more tools, because even though my adjustment may be good, however, maybe that patient cannot handle it. So there are a few times where I thought I was doing a good job, but the body just couldn't take it. So we start to incorporate different modalities, such as Graston, ART, acupuncture, dry needling, decompression, laser, shockwave. And I always tell my patient as a joke, you know the Swiss Army knife? Well, I'm the Korean Army knife. I have a lot of tools that I can pull out. It doesn't mean that the person needs all of it. However, we as a practitioner could judge what can be done. Now, another limitation that I had was, sure, I have all these tools, but some people needed a bit more expertise, more time on soft tissue. So that's when I hired registered massage therapists to spend a good hour to hour and a half doing the soft tissue work, whereby I can't do it. I can't be spending 1 hour doing massage, right? However, if the person's getting that soft tissue work done by a qualified practitioner, then my treatment can be much more streamlined. Another thing I noticed is some people cannot handle treatment right away because their body is too weak. Their inner energy is too weak. And that's when I refer to a registered acupuncturist that work with us and check their pulse, their tongue analysis, and help elevate and balance their chi, or ki, as we call it in Korean. So I always tell people, if you're not ready, it's like me trying to build a house on a mudslide. It just doesn't work. But if your body is strong and you have that vitality, whatever we do as a chiropractor could work better. And that's when I say, you know what, working with these practitioners makes sense to me. Because in the past, 20 years ago, I used to say, I want to be the best I can be. I'm better than you, I'm better than you, I'm better than you. That's where my martial art competition side came in. But as I get older, I think I'm getting a bit smarter and getting a bit wiser to learn to cooperate and work together with different practitioners. Now, I also work with nurses, nurse practitioner who does IV nutrition, who also does something called bioidentical hormone replacement. Okay? I also work with a medical doctor who does something called PRP, platelet-rich plasma, visco supplementation. And these are things that I feel that there's a belief in. Like for instance, 30 years ago, I hurt my knee. I tore my posterior cartilage, and they took out part of my posterior meniscus. And to this day, I gotta make sure that this doesn't deteriorate and cause arthritis. So I looked into PRP. And I get it done on my knee, and it helps, it works. We did another post x-ray 2 years after. Believe it or not, the joint space actually increased. It's amazing. So it's not something that I think that we can do it all. I think if we can actually collaborate with people that has expertise in different fields, we can do a better job. That's me. I get massages. I get chiropractic care. I take supplements. That's me getting PRP from Dr. Kwok. Okay, that's my son getting fire cupping. Okay, these are actually important because if I'm going to work with them, I need to believe in them. Okay, if I don't believe in what they do, how am I supposed to actually work with people? Another thing is you can't save other boat if your ship is sinking. Your body and your health has to be number one priority, I think. I don't see people saying, well, you gotta be healthy and you look sick. Patients come to us and say, Dr. Yoon, you look healthy, I believe in you. But if I'm all crippled up and sick, do you think they're gonna believe in us? And so importantly, we need to actually be healthy in order to recover. So I always believe injury is not process of recovery, but it is process of discovery. That's why I think as we get older, we have more problems. We become better doctors, I think. I do a lot of constant bombardment of education. I do an average about 2 to 3 times a month. And luckily, I have the space, our martial art academy, that we can do that. I actually do education with traditional Chinese medicine of what he knew, and I complement. I do a talk with Dr. Jimmy Kwok on what he knows and I complement. I do it with physiotherapists, stretching, trigger point, acupuncture points. All these things are done on a regular basis. We need to be able to share what we know. And through that, through education, people start to say, okay, I think it is important to take care of myself. And that's where we can actually bridge the gap between. This is my belief. As a chiropractor, in our clinic, we do like acupuncture, laser, decompression, but also physiotherapy, Chinese medicine, platelet-rich plasma. They can be actually recommended. So along with a healthy habit of stretching and self-massage, people can do their part along with what we do to come up with a plan of action. So working with different practitioners is like a feather. You overlap it. You don't just say, let's do this, stop, and then do this and stop. While you're doing that, maybe you can do something to actually compound the improvements. That's the common theme that we have in our clinic. So during COVID, we've done a lot of Zoom workshops. Okay, obviously we couldn't do it in person, but we did a lot. Every week, I was like total ADHD, just going at it. What can we talk about? Headache. What can we talk about? Maybe sleep problem. Dr. TCM doc, what can you say to actually improve that? Indigestion, or lower back, sciatica, carpal tunnel. We've done quite a bit, and we never stopped. After COVID, we continued on to actually do the workshop and to do the training as well. Now, during this whole process of workshops, my sons, I got 3 boys, they really helped out a lot. They were models, they're audio video people, and they also did all the videography. And the silver lining to this is while we're doing this, they were also learning what I did as a doctor. So they were learning. Just like my father told me to do massage on him since I was a kid, I actually taught my kids to understand better about chiropractic care and neuromusculoskeletal care as well. So now whether they become a chiropractor or not, I don't know. I don't force the issue on that. They can be anything that they want. However, if we give them the foundation to take care of themselves, that's where the education first comes in. Try not to start towards the end with all the bad habit. Ingrain the good habit and slowly they kind of work at it as well. Now, not only our kids, I have some students who wanted to study chiropractic come and see me and shadow me and see what I do. And I think I have actually done a pretty good job. I think 7 people that I know became a chiropractor because they came and watched what I did. So I feel good about that. I feel like I'm kind of paying it forward and advancing the profession by doing that as well. Our main theme is you need to be able to educate in mind, body, and spirit. Health is not just body. Health is not just mind. But health is also not just emotion. That's why we say mind over matter or strong body affects mind. So for example, if you're feeling good, if your body feels strong, what does your mind tells you? I'm brave, I can do this, right? But if you're feeling actually weak, you say, you know what, maybe not today, right? And if you're feeling strong in the mind, then your body gets to do more, then your body starts to release all these great endorphin, Teflon, that actually helps you feel even better. So I feel it's a trifecta. It has to work in three and synergy as well. This is something that I truly believe in. When we were kids and we don't have any genetic problem, our potential of health is right up here. But as we get older, and if we don't do anything to take care of ourselves, our potential starts to reduce. Now, my father is 85, knock on wood, super strong, super healthy, but he has a routine and regime. He exercises regularly, meditated regularly. He gets treatment from me at least every 2 weeks, okay? And he eats, watch what he eats, and he visualizes positivity. I want to be here when I get older. But in order to do that, we need to have a proactive thought process. And as a chiropractor and as a healthcare provider, we have that responsibility to educate people to do that. And I think that's a very important thing that we should not just focus on just treating the patient, but also to educate ahead of time. My parents came to from Korea to Canada to give us a better life, me and my brother. But in doing so, I was lucky enough that we ran a martial arts studio, okay? And through that kind of training and education, he emphasized healthy life. And that's the reason why I became a chiropractor, and that's the reason why I continue to educate clients. And on top of that, I'm still learning. I used to practice in California and Alberta. The main difference I kind of notice is Alberta is very proactive. Most people understand chiropractic care. Most people seem to understand health. Secondly, in Alberta, we seem to be able to collaborate with different practitioners much easier. So I just want to say CCA, the whole association Alberta, what you guys are doing here is fantastic. I think you're doing it on the right path. And I'm very proud to be working in Alberta, and I want to continue to do my job to be a great chiropractor. So I just want to say thank you for listening to my story. I really appreciate this opportunity, and I feel honored for being chosen to be one of the keynote speakers. Thank you very much for your time.
Thank that very much, Michael. Your dedication to health and wellness and fitness education is certainly inspirational. I can see that you live it as well as preach it. My gosh, my groin is hurting just from looking at some of those pictures.